the line across which the flattened curve might jump again. And economic policymakers are searching for the answers to what are the necessary precautions we need to have while bringing the business back. For many of those questions, there are no clear answers. The only thing we know for sure is that we're in this together and we need to search the answers together. And that's exactly why we're here today. Let me quickly introduce our speakers and commentators today. We'll start with a dialogue between two speakers, Dr. Jim Yong Kim, joining from New York, and Dr. Zhang Wenhong, joining from Shanghai. I'll introduce more about them in a minute. Then we'll have a discussion with commentators from Italy, from Singapore, and from Hong Kong. Two of them are from the public sector. Professor Michele Gelacci, former Italian Undersecretary of State in the Ministry of Economic Development, and Professor Vernon Lee, Director for Communicable Diseases from Singapore Ministry of Health. And one commentator from the private sector, Mr. Sam Lin Yan Dream, Executive Director of NIF Inc. Before I start the dialogue, I will tell you more about Dr. Kim. I had the pleasure to interview him last year. And we all know that he's the former president of the World Bank, but he's also a trained physician, a public health expert with enormous frontline experiences as well, who taught at Harvard Medical School, who fought tuberculosis in developing world, and who led the WHO's effort to treat HIV/AIDS. In a nutshell, he's really not only a global leader, but also someone who knows how to work globally on pressing public health issues. And of course, Dr. Zhang Wenhong, Director of the Department of Infectious Disease at Shanghai Huashan Hospital, also the leader of the Shanghai Medical Treatment Experts Group. The group is a gatekeeper of Shanghai against the COVID-19. Shanghai is a city with 24 million residents, but managed to keep the total number of COVID patients under 700. And Dr. Zhang has also become a household name in China. Tens of millions of people follow his advice, ranging from whether I should wear my mask or how to make sure your breakfast is immune system enhancing. So in time like this, with so much confusions and anxieties, it's a blessing when you have a professional expert, so incredibly popular and so widely trusted. So without further ado, I'll kick off the dialogue, but with a simple question: what keeps you busy these days? Maybe start with Dr. Kim.
Well, thank you so much, Yixing. This is the event, this is the pandemic that those of us in infectious diseases have been warning the rest of the world about. In September of 2018, right before I left the World Bank Group, we published a document saying that after Ebola, we need to get much more serious about preparing for pandemics just like this. We published it. There wasn't very much attention to it. It wasn't the first publication of its kind. I was involved in other National Academy of Medicine publications. We've been saying that this is possible all along. In China, you had the experience of SARS. I was actually at the World Health Organization with my friend, the unfortunately deceased former Director General of the World Health Organization, Dr. Zhongwook Lee. He asked me to run the transition period in 2003. And so I was there at the end of the SARS epidemic at that time. And in the process of working on SARS, I could see how important global cooperation, fast action, preparedness, I could see how important all of that was. And in addition, the people who are running the SARS response became my very good friends. And they're at the World Health Organization right now, actually running the response today, Mike Ryan especially. And so, this is the big one. And unfortunately, probably the months ago, I saw that the United States had given up on the classic public health measures that we've used with every pandemic, every epidemic. You have to have testing, you have to have contact tracing, you have to isolate the sick, you have to quarantine those that you suspect. You have to, of course, provide treatment. And then depending on what's happening with the disease, you have to have what we call the social distancing measures, the lockdown measures, as much as you possibly can to stop transmission. The point is to stop transmission. But in state after state after state, the public health authorities gave up. And part of the problem was that there was no testing. So you can forgive public health authorities for panicking a little bit because there was no testing available. But I'm living in the richest country in the history of the world, and we gave up on responding in the way that China did, in the way that Korea did, in the way that Hong Kong did, in the way that Australia and New Zealand did, in the way that we know right now is the only way to stop this pandemic. And so I began calling governors, and several of them were friends of mine, and I finally was able to reach the governor of Massachusetts. And being an old friend, I said, you have to look at what's happening in the rest of the world. In Wuhan, they did extremely well with the lockdown. But it wasn't until they did the contact tracing, the isolation, the quarantine, all those things together is what brought the curve dramatically down. And then they were able to more rationally open up the economy. And I told him, right now, we're just on defense. We're waiting to see what the virus will do to us and just sheltering at home. I told them we need to go on offense. We need to go after every transmission. And it's going to take a long time. It's going to be really hard. It's going to be the hardest thing any of us have ever done, but we have no choice. We have to do it. So that's what I've been doing here. And after we announced in Massachusetts that we were going to go on the offensive, at a time when literally no one in the United States was talking about contact tracing, we were able to put contact tracing on the map. And so now New York, New Jersey, Connecticut, Illinois, Ohio, all of them are trying to put these programs in place, because if you open up the economy, you have to have something. If you're not doing the lockdown, you have to have something to try to slow transmission. And so now we've got a lot of states trying this, but it's so late. We're so late to the game, and it's going to be so difficult. So, I worry about a lot of places. I worry about all the developing countries that I've worked in. I think that there are countries in the OECD, but other countries are going to have a more problem. I'm very worried about Brazil. I'm very worried about Peru and Chile also. But I'm most worried about the United States.
Thank you. Thank you so much. And basically, don't give up. And you're hoping the state by state to turn the defense into offense. And Dr. Zhang, you and the Shanghai experience has been offense from day one. So could you share with us what keeps you busy these days and what experiences you want to share?
Yeah, thank you. I think that I'm not so busy like Dr. Kim, because he recently is doing lots of jobs about to control the epidemics in the United States, and also worrying about the epidemics in other countries. But in Shanghai, you know that actually we just passed the most darkness period in Shanghai. So today, actually, I just this morning I went back from the designated hospital. We only have 5 patients there. In Shanghai that we actually quarantine every confirmed cases in the designated hospitals. So therefore, no patients will stay at home and no transmission in the community. So therefore, only 5 cases right now in Shanghai. So actually, I am the group leader in the expert committee. Actually, I'm not so busy like what is it, what I was in the previous 2 months. So actually today, just like Professor Kim mentioned that the close contacts tracing the job is very important in the very early stage. However, today we know that in the world, so many countries, maybe they already stay at the late period or just in the middle period of the epidemics. So it's really a great challenge for us to do the close contacts tracing or not, because it's really a great job. If we found the patients, lots of patients who needed to be quarantined, did we have enough beds, enough hospitals, just like the shelter hospital, to quarantine them or not? This is what we considered about several months ago. But today we know that in China, actually, because we stay in the very early stage in the epidemics globally, so actually we are facing the very tough we were facing a very tough challenge. So in the very early stage, and the different situations we can solve that. So in Wuhan, it's really was the epicenter. So we still have the question: do the close contact tracing or not? Actually, you know that we did that. Just like Professor Kim mentioned, that we never gave up. So actually, we have we do not know we can control the disease or not within very short period. So actually, in the January, the end of January, I give the prediction that maybe we need the 2 to 4 months we can control the disease is the epicenter of China in Wuhan, and many of my colleagues, they really, so they did not agree with me because they think this is this disease is very tough to handle. So therefore, maybe 6 months or 1 year. But today we notice that in the world, maybe 6 months or 1 year is not enough. However, if we do the close contacts tracing for everyone we found.
Oh, I think we lost.
Sorry, we probably lost him, lost Dr. Zhang for a minute. But I'll continue the, okay, sorry, we lost you for a minute.
Okay, I changed the internet, okay.
Both of you just now mentioned contact tracing and use that as the very center of the offense you described. But we also heard worries that contact tracing at a later stage will be too expensive, too hard, and sometimes they worry it's too late. So how would you address that concern, Dr. Kim?
Well, so if you look at the past examples of great public health victories, smallpox eradication, for example, smallpox eradication was one of the most difficult. It's one of the greatest achievements in the history of humankind. We've not yet eradicated completely any other disease. And the people who were involved in it, especially Bill Foege. Bill Foege was head of the U.S. Centers for Disease Control, and he's been a mentor of mine for many, many years. And Dr. Foege recently wrote an article, and he said, in India, there were states, there were days where in small areas, we would have 1,500, the contacts of the close contacts, the contacts of the contacts of the close, they had to get everybody who might have been anywhere near the smallpox patient, vaccinate all of them in what they called the containment strategy. And this was one of the largest, most complicated projects in the history of the world. And yet they did it, they accomplished it, they eradicated smallpox. And so when he reflects on what it took to eradicate smallpox, there's really no contact tracing job that looks too difficult, especially in the richest country in the world. We're talking about a time in India when there were no telephones, when there was certainly no cell phones, there were no telephones, very little technology, and they had to literally walk from village to village, place to place. And so, if you think about, is it expensive, is it not expensive? The United States just spent $3.5 trillion on fiscal stimulus. And, if I put on my World Bank hat, we talk about fiscal and monetary policy all the time. Fiscal policy, literally what you spend in the budget, monetary policy, what the central bank does in terms of adjusting interest rates, buying bonds, et cetera. So if you put all of that together, it's many trillions of dollars that we've spent on the downstream. We're just treating the symptoms right now. And what I've been saying here in the United States is if you were to put together a full testing, contact tracing, isolation and quarantine program, it will cost hundreds of billions, if not $1 trillion. But that is nothing compared to letting this go, right? Fundamentally, we have to understand this is not an economic problem. I mean, I remember the global financial crisis. That was an economic problem, and you tackle that with economic tools. This is not at root an economic problem. It's a public health problem. And so when people ask me, well, you have to make the trade-off between economics and public health, what I tell them is no. If you don't fix the public health problem, the economic problem will just continue. Now, we've learned a lot. And we know masks are very, very useful. I mean, Lancet just did a meta study that came out yesterday that showed that the N95 masks are 96% effective. They're very effective, especially in healthcare settings. Face coverings are effective. We know now that there are a lot of things we can do to lessen infection. And I think the fact that 100% or close to 100% of people in China and Hong Kong are wearing masks is a major reason why I think control is so much better there. So masks are good. We know that. Social distancing is good, and I think people are going to try to watch those to implement those kinds of procedures. So I think we'll have less infection, but unless we're getting at the virus and trying to stop every transmission, outbreaks are going to happen. This is a very nasty virus with all kinds of, I think, unpredicted. We couldn't have predicted, things like the multi-system immune problems of children that we're seeing in the United States. We didn't know about these things. The effects on other systems, the effect on clotting, the cytokine storm that seems to be able to happen even after people recover from the virus. This is a very nasty virus. And unless we get at every single transmission event, it's going to be difficult to feel that we're out of this crisis. And so what I'm saying to business leaders is, if you want to stop the bleeding, if you want to stop having to spend another few $1 trillion on fiscal stimulus and do even more radical monetary policy, fix the public health problem like you did in China.
Thank you. That's a very powerful message, and very encouraging as well, that judging from history, contact tracing and very strict public health measures are doable, and certainly doable in the rich countries, including the US. It's only a matter of resolution.
If I can just say one thing, we said to Massachusetts, first time it ever happened, we're going to hire 1,500 additional contact tracers to support the local health system. We had 45,000 applicants for that job. And part of it was people needed jobs, but the other part was that people wanted to help. They wanted to get on the offensive side to go after the virus. And so there are plenty of people who will do this. It's not easy. The training is not easy, but it's doable. We can train people in a matter of about a week. And we found some extremely good contact tracers, and we're now making thousands of calls a day.
It's good to hear that there's public support of this as well. And I'm curious how many contact tracers are in Shanghai, but also I'm curious what lessons, Dr. Zhang, you think, what lessons and experiences you think China has are most relevant to developing countries? Just now, Dr. Kim mentioned that it's doable to do that in developing countries, but Dr. Zhang, you mentioned in other webinars, I heard that it's very resource intense. Wuhan had 4 times of the resources allocated to it to treat it. So where do they get the resource?
Okay. Actually, Professor Kim encouraged what we have done in China. So we did the tracing, close contact tracing maximally. So our strategy is just to find every patient and to tracing every close contacts and give the maximum hospitalizations for every patient. So if we quarantine every patient, I think there will be no transmission in the community. So there's one side. The other side, actually, we did the social distancing. In China, you know that we always, like other countries in Eastern Asia, we have taken the social distancing strategy very well. So I think if we give a score about the quarantine, tracing, and social distancing, actually, I think China, most of the time, its score will be higher than 95, I think. So it's very high. Because I think why we did that so strictly, and actually at a very early stage, so some friends in the other countries, they did not agree with us, and also did not with what have done in other countries in South Asia or in Singapore, and also in in Korea. So they have taken some similar strict strategies. So actually, why I think we did that so strictly for the quarantine and the tracing, because there's a study which published in the United States, we know that if we taken every strategy that we did, if we calculated the cost effectiveness, we can find that the contact tracing is most cost effective. So if we close, just like recently we closed all services and close the bars, clubs, sports, conference, and the travel, and if we close everything, I think it's very, very expensive. So therefore, if we take the close contact tracing, I think it's most effective and most less expensive. Therefore, it's the most cost effective compared with other strategies. China actually we China, that actually in China, for per person we are not so wealthy. Of course, in the whole country, so GDP is very high. However, for the medical resource for per person, actually, we are not so high like that in United States. So actually, if we compare the ICU beds, compare the hospital capacity with that in New York, actually today, I cannot imagine that if we have if we have 300,000 patients in my city. So actually, if you do not have much money, you have to do the close contacts tracing very strictly at a very early stage. So therefore, once a time, I met some colleagues from Bangladesh. So they told me that they only have 60 patients at the very early stage. I told them, if you take the very strict close contacts tracing, you can control the disease like what we have done in China. But they told me they cannot find the source of the infection. So therefore, I know that there are lots of community infection already transmission there. So in this situation, I think we should do this aggressive testing. So one side we should do the aggressive testing. It's also very cost effective. The other side, I think we should do the close contact tracing and then quarantine the patients as possible as we can. If we can find the 50% of the patients and we quarantine 60% of all the patients we found, I think that the reproductive index will be decreased. So today, if we did nothing, I think if we bring back to economics, bring back to a normal life, I totally agree with you. I think, according to my experience, they did not do enough diagnosis. They did not do enough tracing. So actually, if we want to control the disease like what we expected, I think it's almost impossible this year. So my question for Professor Kim is that if we did the tracing very good, if we do not have a vaccine, can we still control the disease in United States or in some other country, like in European countries? Today we only taken the close contact tracing and the quarantine and the social distancing. And we also we not have a vaccine. Can we control the disease as we expect? That in the smallpox, that smallpox just the close contact tracing plus vaccination, so succeeded in the
right.
end. So how do you think about the COVID today? Yeah.
Well, I'm extremely worried about it, and I think there's an enormous amount being invested in the vaccine response in China, in the United States. There are things about the vaccine response that worry me. I mean, the very large multinational pharmaceutical companies, for example, Merck developed an Ebola vaccine that's been extremely useful. But the big pharmaceutical manufacturers who have the most capacity for doing this kind of work didn't get involved until relatively late in terms of doing the vaccine research. So we have a lot of small groups. And my goodness, I hope, I'm as hopeful as anyone that we'll have a vaccine soon. But if you look at the kind of things that we're seeing, some of the very strange clinical cases. I mean, Dr. Zhang knows. I was trained in infectious disease, but Dr. Zhang's an actual infectious disease doctor. You've heard of this multi-system immune syndrome in children. What seems to be happening is that the coronavirus create a kind of immune enhancement, that creates these cytokine storms and things like this. And so the question we have to ask is, will vaccines have that kind of effect? Will you see a kind of immune enhancement effect in some of the people who get the vaccine? So it's not, I don't think it's going to be simple. I sure hope it's as quick as we can imagine. But right now we don't have a vaccine. Everyone got very excited about remdesivir. I think the data on hydroxychloroquine is very clear that it can be more damaging than helpful, and that really is the various warnings are now out there. If I were in the hospital, would I take all these drugs? I'm sure if I were Dr. Zhang's patients, he'd give me these drugs, but these drugs are not changing the way that we deal with the virus. It's not such a good treatment that we don't have to worry about infection anymore. And so with that, all we have is the public health response. I've called it the 5-part plan, which is the social distancing, testing, contact tracing, isolation and quarantine, and of course, treatment of the sick. Those 5 things, that's what we've got right now. And so it's not under control in the United States. It's not under control in many other parts of the world. And Professor Garaci will be on soon, but even in Italy, where they've done such a good job with the social distancing, I think that they're now trying to put together a much more aggressive testing, tracing, isolation, and quarantine system, because as you remove the impact, which is very real, of the lockdown, you have to have something to replace it with, and that's got to be the public health response. And so, Dr. Zhang, unfortunately, I think it's going to get worse. I think there are going to be more cases. I think we're going to be, unfortunately, facing other lockdowns. Maybe not in New York. Maybe New York will be better off. But we're going to be facing other lockdowns in other cities. We're already seeing the cases going up in the southern states in the United States. And I think that right now, most of the people who are pushing so hard to open up the economy are engaged in magical thinking. They think somehow the virus will behave differently in the United States than in other places. They think we'll have a vaccine soon. They think remdesivir is gonna protect me. And so I think we're in for some very difficult times ahead. And my efforts have been focused on saying, you've already spent $3.5 trillion, and this is in my discussions with members of the U.S. legislature. You've already spent $3.5 trillion. If I could tell you that the only thing that's going to slow this down is the public health response, how much would you be willing to spend? And so we're trying to have that conversation, but it's very difficult. And mask usage is very low in the United States compared to Asian countries. And the most troubling thing of all is that there was the recent survey that asked Americans, if there were a vaccine for COVID that was effective and safe today, would you take it? And only 50% of American people said yes.
And Professor Zhang?
I think he may be frozen a little bit.
Frozen a little bit? Actually, my next question, what kind of safety net do you think should be put in place? Is the 5 elements suffice?
Well, so here's the other thing that has been very troubling to me. There are different people, some of the modelers and others, who early on suggested that this is not a serious illness, that the fatality rates have been exaggerated. Very soon, everybody in the United States, or 60-70% of the people in the United States, will be exposed to the virus. We should just wait until we have herd immunity, right? That was what a group of people said, right? And so, there was encouragement to take the approach that was taken in Sweden, which is a much looser approach to social distancing. Well, Sweden has 3 to 5 times the number of fatalities compared to the surrounding countries. They have many, many more deaths in Sweden. And the economic projections for Sweden compared to its surrounding countries is exactly the same. So in other words, right now, we have no idea if is there going to be any economic benefit to Sweden letting so many more people get infected. Bottom line is, though, Sweden is nowhere close to having herd immunity. In New York State, that had the most infections by far, we're at best at between 15 and 20% of positive cases. So in order to get to herd immunity, you'd have to go through this experience 2 more times to get to 60%. And if we did that in the United States, just waited around for herd immunity, which some people are still suggesting, if we did that, the death rate among African Americans would be 2.5 to 3 times higher than for white Americans. For Latinos, much higher death rates for poor people, much higher death rates for the people who are working in the so-called essential jobs, in the frontline jobs, lower paying frontline jobs. So if we don't get aggressive in trying to stop transmission, what's going to happen is that the poor, African American, Latino, those with other underlying conditions, those who lived in cramped quarters, the elderly, those are the ones who are going to die in much, much higher numbers. And so, there's a very strong social justice element to what we're trying to do to get this response going. One of the things we found in our contact tracing program in Massachusetts is a lot of what we're doing is helping the poorest in Massachusetts protect themselves and protect their family members. There are some communities, Chelsea is one, that has a very high number of Spanish-speaking people, and they're living 4 and 5 people in very cramped quarters. And so when we call them and when we reach out to them, what we're finding is that helping them with food, helping them with putting them in a dormitory or a hotel so that they can protect their loved ones that are living with them, that's one of the most important things that we're doing. So contact tracing is not just the best public health strategy in terms of social welfare, but in the poorer areas is where the issue becomes so urgent. And it's going to be the case, and I think in many European countries, Italy as well, I understand, with the multi-generational homes, finding ways of doing effective isolation and quarantine is always an issue.
Okay, thank you. And I think it's also time that we can compare the country experiences in the contact tracing and in fighting the virus according to their own conditions. So let me welcome the commentators from 3 different parts of the world. And the first one is Professor Geraci, currently in Rome. And he spent a long time in China and in the UK. And then he headed Italy's economic and trade policy from 2018 to 2019. Professor Geraci, so what was the Italian experience? And you are opening up your economy as well. Did you see the safety net that Dr. Kim has just mentioned?
Thank you very much. Good afternoon to everyone. We are just now in the process of reopening our economy and society. But I do think, and in response also to Professor Kim that was asking before, I think we got a little bit stuck in the middle because we did not do early testing. We don't even have an app for contact tracing. Just last night, we have a trial test of a technology. And probably the Italian society lacks the consciousness that Asian societies have for having experienced the SARS and other epidemics in the past. I think we have, in a way, misunderstood the dilemma between health and economic was really not there. And we then did one step towards preventing the propagation of the disease, one step forward on health, one step backward in the economic, and then we reverse that. And so it's most like an elastic without a clear plan. We have been looking at whether we should use the Korean model or the Chinese model or model of other countries, which we haven't done it. So in a way, it's a little bit too late for us to do that. We need to catch up. The only thing we can do now is to enforce quarantine. Professor Zhang was saying before that people in Shanghai who were sick were basically at home. I'm sorry, not even at home, were in centers, so they were not allowed to move around. Of course, this is something that we cannot do in Italy. And so we are now, in a way, stuck between these 3 objectives. We cannot enforce quarantine. We don't have early testing. We haven't done it yet. and we don't have the app for contact tracing. And the economy that has been penalized over the last few months is now asking the government early and well quarantine. Is that we dragged our feet since February. Now it's been almost 4 months, and now the economic pool dominates the health, and we are like a little bit playing with minimize contagious and probably a little bit of luck, which is what we need now. And the debate in Italy is now intense between has the virus died? Is the risk of contagious now too little to worry, or is it just hiding and ready to re-emerge later on? And so I think this is a little bit the struggle that we are fighting. But what I want to emphasize to the viewers is that, and this is my view as a politician, as a observer of social behavior, is that the population has not perceived the risk. Also because we had a asymmetric geographic poor. So people in the south have put the economic not affected them too much. So they wonder, why are we still in lockdown? We need to reopen, especially now in the summer, they live off tourism. While the north has been affected both from a health point of view and from an economic point of view. So I think this geographic asymmetry does create a perception, and the government cannot split the country into two. And that is another challenge that we haven't yet, let's say, managed on how to solve it. I think I stop here for my initial 4 minutes comment for the time being. Thank you.
Thank you. And since you asked the question, let's move on to Professor Vernon Lee, that whether hot weather will help contain the virus. And also welcome back to the Taixing virtual event again. Singapore will end its circuit breaker today, which means the end of its lockdown. As one of the most open economies, how do you balance the disease control while keeping your economy open?
Of the virus, so I wouldn't bet on hot weather alone of affecting the virus spread as the summer comes in the northern hemisphere. I think key to our strategy, at least what we've been doing in Singapore, is to have an evidence-based and also a risk-based approach to our policies and our operations. And this is based on the actual risk of COVID spread that we observe through various indicators that we have been monitoring across time. And through these indicators and through our risk assessments, we hope to stay a step ahead of the virus. You talked about the circuit breaker, which we have just ended today, and that has been extremely effective in reducing community cases. But we entered this circuit breaker not because we had a large number of cases that had overwhelmed the system, but it was in anticipation of a possible rise in cases because we had a sort of a second wave of importations from all across the world, and that had seeded community transmission. And we wanted to be able to control and bring that number down to as low as possible so that there will not be a huge or detrimental and long-term impact on society and economy. So that's why we entered circuit breaker with all the measures that we put in place. And now with evidence that community transmission is extremely low, and we have the capacity to do contact tracing, surveillance, the healthcare capacity to deal with this. And also throughout this 2-month period, we have been working across different sectors to empower and strengthen their safe management measures such that when the economy opens up again and people go back to work, there will be better risk reduction activities that companies or government agencies can roll out to reduce the risk of spread. And perhaps this is an opportune time for me to talk about the many layers of measures that we have put in place. And this is really what I call a Swiss cheese approach, where no single measure is totally effective, but multiple measures will provide this safety net where if it goes through one layer, another layer will hopefully catch the virus. And this includes many different measures that have been performed the world over. So we have built up a surveillance system with comprehensive testing strategy and also testing capacity so that we can detect as many cases as possible. We have also built our healthcare capacity to keep complication rates low. And I'm quite pleased to say that Singapore has had the fortune of having very low complication and mortality rates because we identify cases as early as possible and provide them with the best medical care that we can. We also have built up our contact tracing and active case finding. And we do active case finding around them to find more cases. And then for every case, we would isolate the cases and do contact tracing to quarantine close contacts to prevent onward transmission. Then we also, as I've earlier mentioned, rolled out safe management measures, which includes the wearing of masks, safe distancing, reducing of contacts in the workplace and in the community to reduce the risk of spread. And finally, last but not least, public education, because we want to emphasize to the public that they have to maintain good hygiene. They have to be socially responsible. So if they're ill, please see a doctor and stay at home to prevent spreading the disease to others. And this is all not just the government's responsibility, but we have to work with all stakeholders and with the community. So for the next months or even years till a vaccine becomes available, we've been telling the community that they have to change the way they live. It's not going to be the normal as in the pre-COVID normal, but a new normal where we can live with the virus and we can stay ahead of the virus in terms of disease spread and to contain it so that the economy can go back to as normal as much as possible. And we are also able then to look at ways to, for example, open up trade, travel, and so on, which is so important, not just to Singapore, but to the rest of the world as well. So with that, I thank you, and I'll be happy to take questions later.
Thank you, Professor Lee. And the new normal, yes. So Sam Lim, how does business see the new normal, and what comments you have for the policymakers, public health policymakers?
Thanks, Xing. I think this thanks all for the comment. I think in the sharing, it's very helpful to people like me as a businessman. So as the only representative from the private sector, I actually like to ask a few questions. I would love to hear all your view. One is that as we're talking about going back to normal, business normal, when do you, Dr. Kim and Dr. Zhang, when do you expect globally, because we're talking about globalization, when do that will go back to normal? Like I can travel to US, I can travel to Europe. That is the first question. And the first question seems to be difficult to achieve, the first goal. The second goal is that because the Asian countries seem to doing a better job. So when do we expect that I can travel to Singapore? And when can you expect travel to Southeast Asia? I can travel to Japan. When can that happen? And the sub questions is actually, I actually live in Hong Kong. So many of my friends ask me to ask the question on behalf of the Hong Kong people, because the Hong Kong government just extend the travel ban for another month to going back to go mainland China. So my question to Dr. Zhang is that, is this type of, because Hong Kong has been doing a very good job in terms of containing the virus. So is this their overreaction, or when do you expect Hong Kong, the travel between Hong Kong and mainland China can go back to normal? So that's my my three questions. Hopefully I can get some advice from that. Yeah.
So who'll take the first one? Maybe let's start with the more practical one. Professor Lee, when do you think the travel restrictions will relax? And do you see there could be a kind of a bubble in Southeast Asia that among the countries that have doing better job containing the virus?
Yeah, I think there's a lot of discussions going on right now, and I think it's difficult to say when and how much travel will be relaxed, in the near future. I think where countries have very similar, sort of disease incidents, it is extremely possible to have, sort of travel lanes open where the risk of being in, risk of exposure and being infected in one country is no different from being in the other country. So then, movement between those two countries would be possible. But all this is contingent on many factors, including setting up protocols and other procedures to allow this to happen.
And maybe we should ask Dr. Kim for this. When should we expect trade and economic activities returning to normal globally? You have to unmute yourself, I think.
All right. I think, unfortunately, I think it's going to take some time. And of course, you know, the answer is that when we have a vaccine that's effective and that we can give to, you know, 7 billion people, then I think things will be completely back to normal on the one hand. On the other hand, I think that something has changed forever. And this is, you know, Dr. Zhang and I, as infectious disease people, we always knew that a virus could potentially bring down the global economy. I used to say it, you know, during the Ebola crisis. I said it all the time. I said, if we do not get Ebola under control, and it goes to Delhi and it goes to Karachi, if this happens, then this really could bring down the entire global economy, which is why when I was at the World Bank, we intervened so aggressively in the Ebola epidemic in the 3 countries in West Africa. And so we always knew this is possible. Now the entire world knows that it's possible for a single virus to bring down the global economy. And so I think it will always be different. You know, some of the things that we're seeing, I'm also now working in the private sector. My job now is to build infrastructure in developing countries, something that I worked very closely with the Chinese government on when I was at the World Bank Group. It's a commitment that I share very strongly with the Chinese government. And so from the private sector perspective, what we're seeing, for example, is that even in China, the demand side, I mean, excuse me, the supply side, the services are up and seem to be all, you know, moving back to normal fairly quickly. But on the consumption side, it seems that there's still some issues. And so I think that you know, before consumers will completely get back into the behavior that they were in before the outbreak, I think that's going to take quite some time. So you know, what are the drags? What are going to be the great drags on the global economy? I think the fact that the U.S. has maybe 1/3 of all cases, I think this is going to be a huge issue for the world. I think the fact that in Europe, the response has been, you know, as checkered, as different from country to country as it has been in the United States. Some countries have done quite well, others have not done so well. I think that's also going to be a problem. I think that what we're seeing in Latin America, the huge numbers of cases that now we're having in Brazil, I think those are all going to be real issues. And so, you know, travel getting back to normal, I think is going to take quite some time. But right now, for example, one of the businesses that I'm in is in the transport industry, and we're trying to figure out what would safe travel from the parking lot of the airport to, you know, wherever you're going in the country that you're going to, what would that look like? And again, there's lots more data. We know PPE is much more effective than we thought it was. There are lots of things that we can do. Fomite transmission from touching surfaces may not be as serious as we had originally feared. So we can figure all this out, but the thing that we can't force is people's behavior. And when will consumers start behaving as they did before? Again, I think that if every country can get to where Hong Kong has had only 4 deaths. If every country can get to where New Zealand and Australia and Korea, you know, China, chasing down every single infection with their public health approach, if we can get there, then I think it'll begin to get back to normal. But only with a virus or much more effective treatment will this completely go away. But then let me add this caveat. That's just for this version of SARS-CoV-2. Next year, we could have a different version of SARS-CoV-2. The year after that, a different version again. And so when I talk about putting the full public health approach in place in every state in the United States, what I'm really saying is we're going to have this in place now in perpetuity, forever. You know, just like the security at the airport got so much better after, or so much stricter after 9/11. I think this is going to be part of our lives for quite some time because we now know that this is possible. Every country is going to have to be able to respond as quickly as the Asians did. And the Asians did it because of their experience with previous epidemics. Not everyone in the world has this experience.
Thank you. That's a very important warning that the new normal might stay with us for a longer term. And Dr. Zhang, welcome back. And while you're away, Sam Ling asked you a very practical question. When would you expect the travel between mainland China and Hong Kong will resume normally?
Yes. Actually, I really want to. We can go to the new normal, and especially for the Hong Kong and the mainland. I have Hong Kong. I really want to be there to meet professor there and discuss about how to control the COVID in mainland and also in Hong Kong. Because today we all of us we will talk about how to go back to the new normal. However, the situation in different countries is totally different. We know that Brazil and in some South America is still increasing, and the United States just keep the platform. And the East Asian almost several cases, and in Europe, and maybe several less than 100 cases, and China almost 0 cases today in China. We only have the imported case today. So the China government today, we just they want to control the disease at the level of the 0 cases. Actually, I know that in any country in the world, maybe the government will not think about that because it's really a tough job. However, according to our experience, we have done that. So actually, it's really beyond my expectation as a clinical infectious disease. We know that the flu and the smallpox, if we have no vaccination, almost we cannot eradicate a virus. But today in China, in Wuhan, lockdown and control the disease in Shanghai, other cities at a very early stage, tracing every patient that we found. Actually, we know that we have almost several months, several weeks, we did not have any case. So maybe you cannot imagine that. But actually in Shanghai, every hospital here, just like my own hospital, we do the testing for all the patients who administrate the hospital, almost 700 a day. So in Shanghai, totally we did almost 40,000 a day in Shanghai, but we did not find any cases here. Only several cases imported from Wuhan. You know that there's some asymptomatic cases there. But recently we know that they have did almost 10 million detection in the Wuhan whole city. But actually they found that the incidence of the asymptomatic is not so high like the very early stage. So therefore today I think maybe we need several months later, the Wuhan itself, it will be eradicate all the virus infection as asymptomatic cases. So today, so I think the idea in Shanghai and Singapore, maybe we are very similar. However, our strategy is different. China, we want to control the disease at 0 cases. But Hong Kong, maybe it controls disease at a very low level and will not stop the economic and the school and everything in Hong Kong. So this is the difference between our two parts. So I think if we, the airline, actually, according to my opinion, so actually I want, if the Eastern Asian reopen the countries between different Eastern Asian countries, I think China we will reopen. We will not insist that 0 cases in our own country. I think in China we will not stop the communication between the two parts of China or different country areas in the world. So once the Eastern Asian reopen, I think Singapore and the air flight to Hong Kong, the Singapore to Korea, I think China, we will reopen everything. However, I think it's you know that today we did the detection for every people who landed in China. So in Shanghai, once they landed in the airport, we did the sequencing. So in the future, our strategy just firstly we want to control the disease at the level of 0 cases in my countries and keep the very low imported cases. Once there are imported cases, we will control the patients in the closed circle, and we will
have the 2 weeks so quarantine. So I think if several months later, once there's other countries, they will decrease the. I believe that in Asian countries, Eastern Asian countries, the Korea, Japan, and the Singapore, and there's someday they will control the disease to the 0 cases. So if like that, I think all countries in around China and we will do together. So the Eastern Asian one area, and then maybe European another area. So we will take some similar strategy. So today, if we want to go back to the normal life, I think it's really a great challenge for the whole world. But I think we still need to work together, fight the virus together. So I think we should find the way before the vaccine launched, I think. Yeah.
It's very important. And let's hope for the East Asian-wise reopen with the help of fast testing and strict measures, similar strict measures. So we still have some time left. I want to invite questions from the floor virtually. And we have a few questions submitted already in the Q&A section. And we have some questions submitted before during the registration as well. So I'll pick the question from the Q&A button, from the Q&A section. If you want to submit anything, please put it in over there. So the first question is from Dr. Cheng Jian. He's also an advisor of Caixin Insight, our think tank, to Dr. Kim. How likely is a second wave when economy reopens in the United States? Will it be bigger than the first wave? And what is the consequence for other countries, including China? I think you touched upon some of this already.
Yeah. Well, you know, my friend Anthony Fauci. Anthony Fauci is the head of the National Institute for Allergy and Infectious Disease at the National Institutes of Health, and he is not quite as popular as Dr. Zhang, but he's also very popular in the United States, and he's an old friend of mine. The first time I called him in the middle of the coronavirus, he said, "Jim, what is this now? 5 pandemics that we've worked on together? We worked on tuberculosis, HIV, cholera, Ebola, and now coronavirus." And so Tony has said that the second wave is inevitable. It will happen. And whether it will be bigger than the first, I don't think it'll be bigger than the first. I think because, you know, so many people have learned about social distancing. You know, you have to understand in the United States, the notion of social distancing, there's still, there are places, you know, bars and saloons, places in the United States where the sign outside says no masks allowed. You couldn't even imagine that in China, I think. But you know, there are places that are aggressively anti-mask, which is you know, just to me crazy. But that's what we have in the United States. And so because of those kinds of situations, I think you know, other waves are absolutely inevitable, and the implications are serious, are very, very serious. I think that you know, it's you know, somebody asked me what are the things, is there anything positive that's come out of the coronavirus? And I said, well, you know, I think for human society, we've learned a couple of things, that in fighting coronavirus, the 2 things that are most important for societies are, first is humility. You have to be humble in the face of the virus. When I hear Dr. Zhang talk about the virus, you know, Dr. Lee, when I hear my colleagues in Korea talk about the virus, it's with utmost humility. And they talk about the virus almost as if it's a person with characteristics that hides some places, doesn't hide in others, you know, that goes after a certain demographic. That's the level of commitment and humility we have to have in fighting this particular virus. So humility is the first. Second is solidarity. You know, solidarity means that people wear masks knowing that they're not necessarily protecting themselves, they're protecting everybody else in society. And so, you know, if you have humility and solidarity among people in a society, then you can take that first step in fighting the virus. And so what we hear in the United States is, yes, but you know, the US is different and we have different values. We came from countries that were repressive and we want to be free, okay? I'm just telling, and what I've been saying to the American people is, okay, great, but you are not going to persuade the virus to act differently based on those arguments. Viruses can't be persuaded. They'll do what they'll do. And so the humility in the face of science, you know, I think it's just fantastic that Chinese people love listening to Dr. Zhang. I mean, it's in some ways, for a portion of the population, they love listening to Dr. Fauci as well, because he's bringing science in a way that people can understand. That's the kind of humility, the kind of solidarity that we need from society to society. We're not going to have, and therefore, I think we're going to see more peaks, and I think that the drag on the economy is going to continue. And we're the hopeful thing now is that many governors in the United States have come to me and said, okay, we want that program too. We want to do contact tracing. We want to go on offense. And if we can get enough of the governors in the United States to be committed to ultimately zero infection policy, if we can have enough governors doing that, then I think we can slow this thing down. But it's gonna take time.
Very powerful message. And let me move on to the next question that from actually a combined question for Dr. Zhang from our audience in Singapore and one from Hong Kong. Can you discuss the policies announced during the Chinese 2 sessions this year, particularly with the regards of the post-COVID fight? And also going forward, will the Chinese central government allocate more resources to the public health system? Do you see that coming, Dr. Zhang?
Yeah. Yes. You know that the 2-session conference in China is very important at this time. So because this time the China controlled the disease, so just within the several months. So today, we just take the strategy what Professor Kim mentioned that because China, we are not so wealthy per person. So therefore, if there were lots of patients here, I think medical resources would be very, very limited. So today there's a 2-session conference. So we discussed about that. So the strategy in the future, we just want to take the experience what we had in the first stage in this epidemics. So we want to strengthen the public health system, just like Professor Kim mentioned that CDC staff do the tracing. But I discussed about the issue with my CDC colleagues. So if there are lots of patients, more than today, you know that in Shanghai, we just have 700 cases here. So if there's 70,000 patients here, I asked my city staff, can you do the tracing again here? They think they did not have enough as a CDC personnel. So therefore, in the future, our strategy is that we just strengthen our public health system, the one side, another side, always we will take a strategy to control the disease at the very early stage. If we stay in the later stage, just what happened in Wuhan, we had the experience already. We have to gathering all the support from around all the region around the whole country to solve the problems. So today, I think the 2-session conference just gave us the further support to enhancing the strengthen the public health system, and also in the next stage we will control these epidemics. So at the very early stage, you know that we will take the tracing and testing. So this is the 2 kinds of the strategy we take today to keep the 0 cases in the local cases. However, we still will control the imported cases in the other side. So someday that the whole country, we will control the disease very well together. I think it would be better. This is one side. Other side, I think I will expect that someday the vaccine will launch. But like the Professor Kim mentioned, the safety and the efficacy of the vaccine, we need to see if we have a very good vaccine or not. So in the future, we still work together, and we work with the solidarity and to end the epidemics in someday. Yeah.
Okay, thank you. So basically, public health measures will never relax, and in order to keep the virus at the early stage. So next question for Professor Geraci. Please talk about how to keep politics out of international collaboration in developing a vaccine for the virus. Can you comment on that? It's from an audience from US.
As halfway between politics and economics, I think, in my view, it's very easy. I think today we have re-emphasized that this is a health problem. This is not a political problem. This is it does lead into economic problem. It does lead into social issues. We did actually emphasize that this virus it can actually divide the society. It would hurt maybe the weakest people more than the rich. It would hurt less those that have the luck to be able to work from home with a computer with limited interaction. And maybe it would hurt more the people who live in narrow streets in the poorer areas, like we may see in Brazil or in the streets here in Naples. And so I do think the cooperations, is key. We have Professor Zhang mentioned before how we want to see the flow of people to restart to a new normal. And if we are moving back to this new normal where we can see travel again, we cannot have governments get in the way with their own geopolitical agenda, because this is definitely not the time to find local solutions. But I do think that we need to cooperate, exchange views. And let me re-emphasize the words of President Kim. I think Europe and the West needs to be more humble against the virus, but also against, towards other parts of the world. And this virus is showing that the globalization that we were dreaming of, that bring benefit, it can also bring some dangers. And so we are all on the same boat. But this is my message to the leaders and the thinkers and policymakers in the West. More humility in dealing with the situation. Lower the tones in the debate and cooperate more. Do not get hung up on the mistakes of the past. It doesn't matter where the virus started from. This time was in one place, next time will be in another place. We have seen that this is not the first time. This is not the last time. We will have Corona 2, 3, 4 in the next few years. So we cannot just get tangled into where it started from. It does not matter to the extent of putting the weight of the guilt on someone, but just to help solve it. So I think politics should be away from it, and that's why layer, the Belt and Road of Health. So it's a Idailu, but it's not just infrastructure, but it's also exchange and cooperation at health, because we are realizing that health now becomes the most dominant problem for mankind and for the weakest. It's the virus is Darwinian. It gets worse for the people who have the least means to react.
Can I say, Li-Xin, can I just, Professor Gracchi, that's so very inspiring what you just said. And I just want to give one story. While there's all of this very negative talk going on out there, let me just tell you a story about how Massachusetts, the state that I'm helping, protected its own workers. And so, it starts with Ambassador Kui Tiang Kai, ambassador to the United States. And then we began speaking with Ambassador Huang Ping, the Consul General in New York, because we needed to get PPE, and we could not get it in Massachusetts. And all the different states in Massachusetts the states in the United States were fighting over how to get masks and gowns and shields, etc. So we began working with the ambassadors, and then we worked with authorities in Shenzhen, and we had a plane that was owned by the most famous American football team, New England Patriots, fly in and bring masks back. But then since then, in your city, Dr. Zhang, the Civil Aviation Authority of China helped us. The Shanghai Airport authorities helped us. My friend Echo from the Chinese company Small, brought all of these groups together. And it was so difficult because there were so many flights coming in and out of Shanghai, many of them coming in because there was just so much activity and so much demand that sometimes they'd have to fly out empty. But in Massachusetts, with the help of the ambassadors and with the help of the right people in even the aviation authority, we brought 9 million pieces of PPE to Massachusetts. Massachusetts, you know, Dr. Zhang studied here. It's the place where they have, you know, some of the greatest medical centers in the world. And the greatest medical centers in the world, Harvard Medical School, Brigham and Women's Hospital, where I trained, were not able to protect their own health workers from the virus. And it was this coordination, incredible effort on the Chinese side, on the Massachusetts Health Department side, coming together to bring 9 million pieces of equipment. Because after the New England Patriots fight, there were 6 more. So I just want to say that even in the midst of all of this tension, there are wonderful things going on. And it really is China, you know, with the Belt and Road Initiative for health. That's really what we saw. But it wasn't to a developing country, it was to the state of Massachusetts. So I just want to say thank you to the Chinese people. Thank you to everyone in the Shanghai Airport Authority, to the Civil Aviation Authority. It was an incredible feat. And but think of the irony of it. You know, Dr. Zhang came to Boston so he could study in some of the greatest healthcare institutions in the world. And we ran out of masks to protect our workers. And China helped us to provide them. So, you know, among infectious disease doctors, you know, we're kind of a sisterhood, brotherhood, where, you know, we would never think about blaming a country, just as Professor Geraci said, blaming a country for a pandemic, especially in this case. I mean, it's possible that a country could start a pandemic, but it didn't happen here. We would never think about that. We would just think about our mutual patience. That's what we talk about when we talk to each other across national boundaries. We have to bring that sense back to the world. And frankly, WHO should lead. And, you know, rock stars like Dr. Zhang also have to help us lead as well.
Thank you. That's a very heartwarming story. And with that, we're approaching actually to the end of our session, unfortunately, but that's exactly how I want to summarize our session today, that if we learned anything, I want to quote Dr. Kim, that it's humility in front of science and solidarity among the physicians, among the policymakers, among the businesses, among the societies, among us all. So thank you all for joining Taixing Roundtable, and also special thanks to NIF as our partner, yearly partner. And you can watch the replay of the event on Taixing's Chinese and English website. As always, please read our coverage on COVID and more. So I look forward to seeing you all again next month, Taixing Roundtable. And thank you all wonderful speakers for sharing the insights today. Thank you.